Places have changed, faces have aged. Memories are starting to fade, one day at a time. Remember, I'm here with you. You're trying so hard just to keep up. Every day's a chance to restart. I'll still be here, trying to pull you through. Every word that's forgotten, every note left unsung. Trust in me, just hold my hand and take me with you. Bring me into a world no one else can walk through. Hold my hand, 'cause I'm still with you. Love teaches hope, that love teaches joy, enable the ones who are frozen in time. Imagine our hearts choosing to shine on a journey that's yours and mine, yours and mine. Hold my hand and take me with you. Bring me into a world no one else can walk through. Hold my hand. Hold my hand. 'Cause I'm still with you.
When I was young, you held me near. Storms would pass and I never fear. Your smile and kisses I'd hold so dear helped me to be strong. Remember places we've explored, sights and sounds above us all. Memories you don't recall are those I've not forgot. When we cannot see, doesn't mean we'll get lost. When we cannot hear, it doesn't mean we cannot talk. Those crazy years of fighting are now long gone, and I hope you'll sing to me once more. The things you don't remember are the things that I will never forget.
Hi, welcome to the Enabling Festival 2020. I'm Guan, your festival host this year. Now, due to the present pandemic situation, the Enabling Festival 2020 will be traveling into your home. Now, the festival aims to explore, challenge, and shape perceptions and understanding of dementia and caregiving through technology and the creative arts. Now, this year, we will focus on the sense of sight with the theme, Do You See What I See? We have curated many exciting programs for you this year, so please visit us at this website below to see what we have to offer. Now, please enjoy the upcoming program.
Good afternoon. I am assuming we are on right now. Yes, are we? Yes, we are. Can you see me? Yes, you can. Welcome to the Enabling Festival 2020. It appears that despite the pandemic, we are still having these meaningful and very important conversations. But before we start our first Zoom-in session, I'd like to introduce myself. I will be facilitating today's discussion. My name is Oniatta Effendi. I am a batik entrepreneur, a teacher, but also I think most importantly, when you guys called me in to facilitate this, I was most happy because I am a caregiver, a sole caregiver to both my elderly parents. One is 83 and one is 79. So there's nothing I would rather do on a Saturday afternoon than to be in a space where I'm learning about caregiving. Yeah? And if you're on today on this Saturday afternoon with us, there must be a reason. And if that be the case, can you please type the letter C in that chat box so we know that you too are a caregiver, and I can see the screen from here. If you are a caregiver, type the letter C. If you're not, it's okay. Yeah? All right. But before we go into the session, I thought we should actually look at the question that we're asking, and then we'll introduce the panel that's with us today. The question that we're being asked today is, caregiving, have we done enough? Caregiving, have we done enough? And when I first looked at this question, I asked, who are the we? And I made a bit of a small list here. Is we or are we the government? Is it policymakers, healthcare providers, agencies? Are we just looking at caregivers such as myself and my friends out there with elderly parents? And so these stakeholders and these people we call we are that collective society in Singapore, collective Singapore society as a whole, that is part of this whole caregiving business. And this is my cue to introduce my friends today in this little space that we have. So let us first welcome Dr. Tan Weng Mooi, Chief of the Caregiving Community Mental Health Division from AIC, Agency for Integrated Care. Welcome, Dr. Tan.
Thank you, Oni.
Maybe you can tell us more about what you do.
Okay, thanks, Oni. First, I'd like to congratulate Daniel and the team for organizing this despite the pandemic, and also thank you very much for inviting AIC to be part of this very meaningful afternoon. I am a pharmacist by training, but like I always tell people, I've not been practicing, so I only know Panadol, so don't ask me anything beyond that, right? So for the last 30-odd years, I have been focusing mainly in the hospital administration, the last 10 years in AIC, looking into building up the community services to support people with dementia, mental health, and recently also the caregivers. So that's part of my work, yeah.
30 years.
Yes.
So we will have the expertise of someone who's been in healthcare for 30 years to speak with us today. Thank you for joining us, Dr. Tan. Next up, we have Jason Fu, who is the CEO of Alzheimer's Disease Association. Tell us what you do.
So I'm the Chief Executive Officer of the Alzheimer's Disease Association. We call it ADA for short. ADA was set up 30 years ago in 1990 because there was a growing need of help for people with dementia and their caregivers. I was actually part of ADA since 1990, first started as a volunteer, sat on the board of the association for 22 years. And then in 2012, I gave up my corporate work to come and work full-time for for ADA as the Chief Executive Officer. So it's been 8 years. I thought, well, I'll give it a try for about 2 years or 3 years, but it's been 8 years, so it's something that I still find very meaningful. I hope to carry on as long as I can and hope build the association, because the need is growing all the time.
Yes, yes. And as we are speaking, questions are already coming, and so you see that the need is there for a lot of people to seek clarity on a lot of things. And I say this because I'm also encouraging those who are on right now. You can already start asking questions to the panel we have, so don't wait till the last time when I say, oh, okay, we're going to end, and then you all start asking these questions. It always happens when we do these sort of sessions. Okay, I didn't forget you, Tim. Tim Lee is the CEO of Caregivers Alliance Limited. Tim, tell us what you do.
I'm with Caregivers Alliance. We are just a very small charity, so there are 32 of us. So we exist for caregivers, but caregivers of persons with mental health issues, and that includes dementia. So we run training program basically, but we also provide a lot of support for caregivers. I'm very, very heartened as well to have the opportunity to participate in this conference. A lot more emphasis and talk about caregivers nowadays. So that's really good. And they are indeed a very neglected community. So really looking forward to the interaction and the sharing. Yep.
Yes, thank you, Tim. And I'm excited too, because I started this caregiving thing with my parents on a very serious level early this year. And I realized some of these issues are very, very real. And I think it's really wonderful that I'm going to be sitting in for this session to hear what there is out there for caregivers. And in case you're wondering why some people type C on that thing, as we go along and you're listening to the presentations, please type C if you are a caregiver. So we know how many of you out there are actual caregivers and are interested in having this dialogue later on. So without further ado, the question again is caregiving. Where did I write that? Caregiving. Enough or not, I wrote. Have we done enough? And what really is enough? So we're throwing the question back at you. We'll start with Dr. Tan. Over to you.
Okay, thank you. So since I come from Agency for Integrated Care, so I'll be sharing primarily in the overall framework and how, as a government agency, working closely with the various ministries to see how we can support people with dementia as well as the caregivers. So some of you may know AIC was incorporated in 2009. That was when government feel that with aging population, there's a need for us to build out more community care support and services. That includes nursing home, senior care center, home-based care as well. My division, the Caregiving and Community Mental Health, was added in 2011. That was at the tail end of the National Mental Health Blueprint. That's where when the government feel that there's a need now to not just do the outreach from the hospital, but actually embed services and support in the community. And as some of you may know, AIC also has recently have the Silver Generation Office added on, so just about 2 years ago. And that gives us a wide variety of outreach opportunities to see how we could better reach out to the seniors as well as their caregivers. And our role are fairly unique as an agency. We work with various government agencies. Of course, our primary is Ministry of Health. That's where we work with them to create new model of care and support system. We bring in our partners, including ADA, and team and all that, to see how we could create platform where we can brainstorm and interact and see how we can come out with better solutions as well. And very importantly, one of our roles is to see how we could make the navigation system, information, access to services a lot easier for the families. So last year, the government has just launched the Caregiver Support Action Plan. There are 5 pillars there, and after thanks to people like Tim and as well as Jason, we have engaged many of our partners and the caregivers to better understand their needs. So we decided that there are 5 key areas we need to focus on, one of them being care navigation. So there's been a lot of reports about they don't know where to get help. I'm sure Oni can share a little bit of your own experience, right? And then where and how can they get help, right? And of course, the other part is financial support. So that's where the government has changed that and look into how they could provide caregiver grant. Basically, it's money that is given to family who needs help, and they can use that money to provide the support and get whatever resources that they need, right? And then at the workplace, one of the key things, of course, is how can they have better support for the caregivers who likes to continue to work for good reasons, right? And yet, at the same time, have to go through the caregiving duties as well. And for those who wants to come back to work after, let's say, their loved one passed away, that's where now the government look into how can we better support them, reskill them, so that they can come back to the workforce as well. And there are two more areas which we are also looking into is better support for the caregiver in terms of more services, different kind of services, yeah. And for me personally, I feel the area that we really need to work on more is caregiver empowerment and training, because there are many caregivers who are the younger one, who are more educated, right? And that's where we should be able to allow them to self-help and self-care as well. So earlier on I mentioned, right, so one of our role is to look into how we can build up capacity and capability in the nursing home, center-based care as well as home-based care. On top of what we call these traditional long-term care services, we also work with many partners, including like ADA. They came out with new ideas of family of wisdom, which are very interesting kind of way of reaching out to the caregivers and their loved one as well. And of course, BRAM, some of you may know, they do a lot of mindfulness training, getting the caregivers to then also help themselves to relax. Many caregivers feel very guilty, and they feel that, when they have to do the caregiving, they ought not to go out. They feel that they should be at home all the time. But that's not true. They are also a human being. So we are very lucky to have many good partners. Cal does a lot of training. And even Lien Foundation recently came out what we call Head Care, a very interesting way, just like the IKEA ideas, having the catalog, looking into how you could actually make your house much more friendlier and look at the different ways of working on it. Of course, thanks to Daniel and the team, that we have this enabling festival to see how we can create more awareness. On top of all these services, government also has schemes and grants to see how we can better support people that need the financial, right, in terms of the support and service assistance. Within AIC, we also work with the partners and come up with caregivers booklet that go through in terms of the journeys, the resources, how they can care, what can they do, yeah? And also, of course, we also look into the diet when there are evidence that show that if you were to do 4 things, we call it ABCD, right? Physical exercise, brain stimulation, social connectivity, and managing your chronic illnesses and diet. Of course, the studies is using Mediterranean. So we work with Kutipot to come up with adapting Okinawa as well as some Western diet to see how people can use that to prevent even Alzheimer's disease. So this is something that new, as more studies and research come in, we as agency also try to work with our partners to see how we can co-create this kind of new information to enable and empower our caregivers. On top of this, right, earlier on I mentioned one of my own very interest area is how do you empower and enable the caregivers, yeah? So thanks to many of our friends, including, ADA, we came up with this dementia-friendly Singapore. So we have about 8 dementia-friendly community. We are continuing to expand. And the idea is really how do you create a network, a society, a community where the caregivers and the clients feel comfortable to go around on their daily living and felt being understood and not being stigmatized. And they can continue to live well in the community as well. Just to share with you one example that we do pilot at Queenstown together with the Active Aging Group and the CC. So there's a group of the seniors who come together very often. So we started asking them to see what is it their life goal, what is it that they like. Some of them are ex-caregivers, some of them are still providing the caregiving journey. So we asked them, what is it that you want? What is it that it takes you for you to also look after yourself? So they came every month, go through some studies about know yourself, know their own identity, know their body, mind, and soul, meaning they learn about mental health, they learn about dementia, they learn about healthy cooking, right? They learn to social connect. In fact, after 2 months, one of the guys put up his hand and say, hey, I can teach you mindfulness. And another chap say, hey, I can teach you how to use WhatsApp to be connected. Right? So these are what we call the peer leaders, and they come together and help to support each other. And we hope to see more of that all over Singapore, because beyond support and services, we really need the community, the people, the civil society to come forward, including the employers as well. Yeah. And so some of the learning that we had over time is, especially during this pandemic, many of the centers has to be closed, and we know many of the caregivers working from home at the same time looking after their loved ones can be quite challenging. So I'd just like to remind everybody, it's very important for you as you going through your caregiving or going to or know of friends who are going through the caregiving journey to be aware of where they can get help, where are the resources, whether it's ADA hotline or CARE hotline or AIC hotline. Very important to have that, right? And then stay connected through technology. We know like now safe distancing, but you can still do that, right? Through phone, through iPad, through all the technology, video, just like today, right? That's where you could also stay connected, and it's very important. Last but not least, must focus on yourself as well. And don't forget about you are just a human being as well, right? Look after your own mind, look after your physical health, and look after your own spiritual needs as well. I'd just like to urge all of you, those of you who have not downloaded this Dementia Friends mobile app that can, tell you where you can get resources, how you can get help. And in case any of your friends, loved one has got lost, you could actually post it up. And then if anybody to see them, and thanks to Singapore map, they allow us, you can then ping and call the family caregiver. So then instead of them having to be brought to the police station, we have what we call go-to point across the CC shopping mall. So people can then bring them there, or even nursing home. And once again, join us for this festival as well as the upcoming World Mental Health Day online events. Thank you very much.
Thanks, Dr. Tan. I am about to whip out my phone to download the app only because I recall at one point in time my dad hilariously had an appointment at 3 o'clock at the polyclinic, and at 2:45 he was still not home. Clearly he forgot he had an appointment, but he was nowhere to be found. I mean, I don't think he wandered off so far. He went to go and pluck mangoes downstairs. So maybe with this app my neighbours can go and help me find my father who is plucking mangoes downstairs. But thanks, Dr. Tan, for sharing with us all those, it's quite an overload of information actually. So if you want to find out more, I think the website, am I right to say, is aic.sg. That's where you'll find all of the important things that are being said there. And there was a scan QR code that you can scan there. So it's not for you to save entry, it is to go and find out more information about AIC. Okay, and moving on, we have Jason Fu, who will tell us enough or not enough. Okay? Over to you, Jason.
All right, thank you very much. I think Dr. Tan has already shared with all of you all the support that is available for caregivers. And we know today that there's a wide array of programs and services available. So the question is that enough? Unfortunately, I think more can still be done. What else do you think we can do? I mean, so the main things are we shouldn't neglect caregivers. A lot of times, a lot of focus is on the person with dementia, and caregivers is not the focus, but actually to be able to cope with the condition, caregivers are as important as the person with dementia. So we should not neglect the caregivers, and the caregivers themselves should not neglect themselves, because it's important that you keep well to be able to cope with your caregiving journey. It's a difficult caregiving journey. You need all the strength, you need all the support, you need all the well-being to be able to do it. So don't neglect yourself as well. Take care of yourself. And I think Dr. Tan has also shared that about the mindfulness programs, Brahm runs and all that. So it's important for caregivers to know that. Professional help. There's a lot of professional help that's available for caregivers, but sometimes it's the stigma that stops caregivers from looking out for this professional help. They are shy to share with their friends, with relatives, that there's a family member that has dementia. And it's because of this stigma that sometimes they don't go out and look for it. And it's sad because there is help available all the time, and as Dr. Tan has also shared, there's a lot of help available. So please look out for it as caregivers. Providing a single source of information, a one-stop solution. I think Dr. Tan also shared, it's sometimes difficult to navigate what is available out there. There's a lot of help. It's not always easy for a caregiver, especially one who is just thrown into the caregiving journey shortly or in a short time, to be able to navigate and find what help is available. But there is help available, so please look for it. All-round assistance for caregivers, it's not one or the other. It's everything. It's psychological, it's financial, because when you're caregiving, some caregivers have to give up their jobs, and it's difficult as well. So financial sets in. And because you're doing this 24/7, and because caring for a person with dementia is so difficult and so stressful, you need psychological support as well. So, all that needs to be in. Raise awareness, inform caregivers what is available. Again, like I said, it's all there, but a lot of times caregivers look out for help for the person with dementia, for the family member with dementia, but they don't look out for help for themselves. So my advice is, when you look out for help, look out for both. Look out for your person with dementia, but also look out for yourself. Yeah. So just want to share what ADA has done so far to help caregivers. We have a dementia helpline that you can call. We have caregiver support groups where caregivers come together, share their problems, and then we have some experts to also advise and guide the caregivers. We have this thing called a person-centered home-based intervention. It's actually I always call it like a SWAT team like that. It's actually a team of very experienced persons who understand dementia, the condition of dementia very well. Usually it's a multidisciplinary team made up of a nurse, occupational therapist, a social worker, and they will go into the homes of the person with dementia to try to figure out what's gone wrong. Usually when there's a crisis that happens. Yeah. So this is that's why we call it intervention team. We have this elder sit respite care, which is actually for people who cannot come to centers, to daycare centers, because either they're staying too far away or they're wheelchair bound. Then what happens is that our staff actually go into the homes to spend some time with the person with dementia, 2 hours, 3 hours, do some kind of activities with them just to engage them. So and we call the people who go to the home elder sitters. It's just like getting a babysitter to come to your home, but these are elder sitters, yeah. And then we have casework and counselling. I mean, like you say, because of the stressful caregiving journey, a lot of caregivers need a bit of counselling sometimes. And then we have caregiver training. As what Oniatta said, sometimes we are thrown into this caregiving journey. You don't know what to do. And actually, caring for a person with dementia, if you don't receive any training at all, or nobody tells you what you have to do, it's actually going to be very difficult. It's going to be just hit and miss kind of thing. You keep trying new things, and some work, some don't work, and it's going to be really difficult. So we always advise family caregivers, when there's a family member with dementia, please try to come for the training, because we will then tell you, advise you what to do. We'll also prepare you for the journey ahead, so that you know what's going to happen in the next 5 years, in the next 10 years, how it will get more and more difficult. And for families that also have a domestic helper, we also do training for domestic helpers, because these poor ladies from Myanmar, from Indonesia, from Philippines, they get thrown into this caregiving as well, and they don't understand the disease or the condition, and then they really get stressed out, by the person that they're taking care of. So it's useful for them to go through a training as well, and we do training for domestic helpers. We do it in English for the Filipinos, we do it in Malay for the Indonesians, and we do it in Burmese for the beats from Myanmar as well. So we know that English is not their first language, just to make sure that the message gets through clearly to them, and they understand what they're being told or learning. We do it in their own language. Yeah. So caregivers' needs are actually wide and they differ. So that's why it's always very hard. We have to keep constantly trying to find out what's changing. Like, for example, the recent COVID-19 pandemic, that has changed caregivers' needs as well.
Oh, yes.
They couldn't go to the person with dementia couldn't go to the daycare center. They're stuck at home. They want to go out for a walk. They don't want to wear a mask. They don't keep 1 meter distance. All that problem. And some of them get arrested because they don't practice social distancing. So during the pandemic, we actually came up very quickly with a memo. We worked with AIC, and AIC was very supportive. We worked with the police force as well, and the National Environment Agency, right? Yeah,
NEA.
because they are the ones who mobilize the social ambassadors. So we worked with them to tell them that if I give these family members a memo, if they do get caught or arrested, please show them the memo, so that the police will say, okay, you can be excused because the person has dementia. Because that allows the person with dementia to still go out and take a walk during the circuit breaker time, rather than being stuck at home all the time. That helped as well. So needs are always changing. In 2019, we also, together with NCSS, we conducted a survey for caregivers of people with young onset dementia. So young onset dementia is dementia that affects people below the age of 65. So for dementia and Alzheimer's disease, usually it affects people above 65. The risk is 1 in 10 above 65 and about 1 in 2 above 85. So as you get older, the risk is higher. But it's not supposed to hit somebody in their 30s and 40s generally. But the worrying trend is that recently we are seeing people in their 40s, in their 50s actually having dementia. So we call that condition young onset dementia. Yeah. And the needs of the people with young onset dementia is quite different from the people who are older who are affected by dementia. And it's the same with caregivers as well, because young onset dementia, usually for them, the family is still quite young. They have kids still in secondary school. They might be holding a job, and so they lose their job because they can't carry on working, and the spouse has to then start looking for a job to support the family. Kids are in school, they don't understand. So a lot of young caregivers also get thrown into this caregiving journey, and they get very frustrated. They don't know why. We have spoken to some of the young caregivers, and they said, Mom and Dad are supposed to take care of me, but why is it now I got to take care of Mom and Dad? And a lot of them, because either one of their parents have to look for a job and one is having dementia, they are required to come home back from school to help with the caregiving. And that frustrates them, and that makes them really unhappy, because they want to go out with their friends, they want to be hanging out with their friends after school, but they can't. They have to go home because Dad needs them or Mom needs them. And without understanding what's going on with Dad and Mom, they become very resentful of that thing, and of why the parent is now needing their help.
Because
So
it feels that the youth has been taken away.
yeah, youth
from
taken
them,
away,
right?
correct. Yeah, so getting the children, the young caregivers to understand what's going through with Mom and Dad, and telling them that also help is available for them, that would really be useful for them. And I think one of the questions that we saw on Facebook was already asking, what can we do for young caregivers? It's an area that we are still struggling, because it's a new area that we are so, over the years we have got very good with helping caregivers who are older and have people with dementia who are older, but now we are seeing this trend of 4,000 or 5,000 people, that was the last count in Singapore, of people with young onset dementia.
4,000 or 5,000?
Yeah. Every year, about 100 plus to 200 people are diagnosed at that. And so in our centers, we actually see people who are 48, 52, 55, and very young. It's very sad, because it's a long journey for them at that
And the
age.
symptoms are similar, or is it different?
Symptoms are fairly similar, depending on what type of dementia they have. But what we see, which is quite sad, is that we realize that people with young onset dementia seem to actually deteriorate faster than the elderly. Yeah. So it's something that the National Neuroscience Institute is still looking into. What is causing? Why is it affecting people younger, and why is it that they seem to be deteriorating faster than the people who are elderly? Yeah. So we are always constantly looking to find service gaps and introduce new things. So a few things just to share very quickly. Recently we introduced, actually just last week we announced this post-diagnostic support, a new service that we are piloting together with the help of Lien Foundation. And this is actually catching the family members the moment a diagnosis is done. Because what happens is that every time when we try to help a family, or when they reach out to us for help, it's usually when they're in a crisis mode. So first thing, when they get diagnosed, everything seems okay, everything is still all right, manageable. And then about 2 or 3 years later, when it gets really bad, then they start to panic and they look for help. We realized when we learned from Canada and from Scotland that they have a similar service called post-diagnostic support, where the family is connected with the Alzheimer's Association the moment the diagnosis is done, and then the association basically explains to the caregivers what's happening and what are the services available, and guide them along, so they don't then get into this crisis situation so much, and they start to use services a lot earlier than what the families that don't have this program or service with them. The other thing we're looking at is digital care. Because of COVID-19, when our centers were closed, we started, and a lot of associations did that as well. We did a lot of virtual support through videos, through Facebook and live streaming. And we realized that actually it works. And the caregivers responded to us, and the feedback we got was that actually this is quite helpful. It's something that we stumbled upon. We never thought about it. But they say that if you have a video, let's say for example, a video, exercise video that they're interested to do, you can actually play the video 3 times, the same video 3 times a day. And because of their dementia, they don't remember the video. So it's a new video even after the 3 times. So it's really useful for the caregivers. Those times when they can't come to the center, they don't have help, this technology kicks
Allows them to
in,
plug and play,
yes, yeah. So because of the COVID-19, we will explore a lot more on this and work on it, because now we find that it might become a hybrid care where we have physical care in the centers as well as using technology to help them at home. So it's a combination of both, and it's something we found. And integrated support, I think Dr. Tan also alluded to that a little bit, how, our services are a bit fragmented sometimes. How do you pull all of that together? And ADA as well. We've started so many new things. We're getting bigger and bigger. And how do we make sure that when someone comes to us for help, they don't get moved around from one team to another team? Somebody to help them to basically navigate whatever is available. If it's not within ADA, if it's provided by other organizations, so be it, so that they are supported in the best way we can, as holistic as possible. Okay, so I mean, I think this slide's the same thing. We have to constantly review, constantly innovate new models of care and to stay relevant. Yeah, so that's all from me. Thank you very much.
Thank you. Thanks, Jason. I'm feeling like, wow, again, an overload of information. Like, how is it that I didn't know this earlier? How is it? And I bet a lot of caregivers are already asking that question at this point in time. Hey, have a support group and all that. And, before we move to you, Tim, I wanted to ask, how many caregivers actually come to the support group? Do you have any numbers?
It's in the hundreds. So for caregiver support groups, we try not to make it too big, because when the group is too big, people sometimes get a bit shy to share. Yeah. So we try to keep the groups small, about 20 to 30 at most. Okay. And we realize that also caregivers are more comfortable in sharing if it's in the language that they are comfortable with. Right. So we have caregiver support groups in Mandarin, in English, and in Malay. Right. So different, and again, caregivers, because of their commitments, it's very difficult for them to travel very far to go to a support group meeting. So we try to have it at different places at all over Singapore, so that they can, it's easier for them, it's convenient for them to go. So it's different languages, different locations. So it's practically every Saturday for us, because we try to have it on a Saturday when caregivers are not working, so that it's easier for them to come and attend. And it's a lot for us.
Things have shifted as well.
Yes, recently we tried virtual, and it works as well. So we're saying no. So caregiver support groups doesn't necessarily all have to be physical. Yep. A lot of it can be virtual as well. And caregivers are now comfortable. Previously, when we told them virtual.
And so you've done virtual.
Yes, we have. Yes, and it's working. So like I said, it's again a change in the model.
Wow. Okay. Thank you. It does appear that there's quite a lot that's being done. So, and yet, Jason, you're saying more still can be done. Huh? That's a lot on your shoulders. Huh? Okay, Tim, let us hear from you. Huh?
Okay.
Enough? Not enough.
So let me just start with a very short introduction of Caregivers Alliance. So we were incorporated in 2011. We exist for caregivers, but when we say that, we are talking about caregivers of persons with mental health issues. We call them hidden heroes because they suffer from stigma. Nobody likes to tell people that I have a loved one who is not well mentally. But our scope covers dementia as well, caregivers of persons with dementia. And that's because since we started, we do encounter many caregivers who are looking after someone with dementia, but they come for our classes. And later I'll explain a little bit more how we have adapted to kind of meet this particular gap. But yeah, I would like to share a little bit more about the world of caregiving. But before we do that, I just want to share also that in CAL, more than half of our staff are actually caregivers. This is very important because we really understand caregiving. So they've been through that, they know what is it like. I'd like to introduce you to our world, the world of caregiving. And this is how one young caregiver described his world. He used these words and shared that with us. Dark thoughts, cannot think straight, drained physically, and dare not leave the mom alone. He don't feel like working, and his work performance dropped. No choice, no social life, and lost. So this describes the kind of world that caregivers are in. It's very challenging, and it's very lonely. Right? So many of them actually struggle because, in fact, some of them lost their job because performance dropped, right? Many of them actually do something quite different. They actually gave up their jobs, their careers, their dreams, their aspiration. Why? Because they want to look after somebody that they love who has had an illness, right? Mental illness. And they are really heroes in my view because of the sacrifices they made. And they don't shout about it. It's a silent thing. You know? So, and it's really long suffering. I like one of the phrases that a caregiver shared with us. She said, "You help me, I help my sister." I think that kind of sums up the work we do. We help the caregiver so that they can help a person who is suffering from a mental health issue, including dementia. So if you look at caring for somebody with a mental illness, we normally think of IMH. You were COO of IMH before, instead of mental health. We think of hospital, we think of psychiatrists, we think of psychologists, even counselors. So these are the professionals. If you look at it carefully, how much time does a caregiver or a person who is hoping for recovery, how much time do they spend with such professional? Compare that to a caregiver. A caregiver spends almost 24 hours looking after a person that they love who need help mentally. Yeah? So they are spending a lot more time with them. So what that means is, if we can help caregivers, I tell you, we are really going to help those who are looking for that recovery in their mental condition. So I really like this phrase. In a very simple way, it says that caregivers are an important component in the ecosystem, in the mental health space, because you take care of that, you take care of the people that you are really truly trying to help, right? Those who are suffering from mental illnesses. I would like to next talk about caregiver needs. Caregivers know this, right? But perhaps in the audience, we'd like to share this with you. There's a phrase that we use, we call it caregivers to be. The truth is that all of us are caregivers to be. You never know when it'll hit you. So I'd like to share with you what caregivers need. So most of the caregivers that we met, they said to us, because they really love, they are really devoted to their loved one, and this is what they say: I just want to be better at caregiving. I want to learn as much as I can about dementia, the type of care, and so on. They want that information, they want that knowledge. So to be better at caregiving is what caregivers need. Support network. Caregivers need friends. Just now, as I explained to you, some of them are very lonely. They are just hiding in their home. They are not going out. They need friends. They need a group of friends, a group of support network. People who understand them, people who will journey with them, people who will be there when they need help, when they call for help. Right? And truly, caregivers of persons with mental illnesses, they face a lot of challenges because you won't know when a crisis will strike. You don't know when somebody will fall into a psychotic episode. Right? So they need help. They need to call for help, and they hope and they wish there will be people who are there. So you talk about support network. That's really important. Right? Self-care. This is something that caregivers they're not aware of it. They didn't know they need to take care of themselves. So if you don't take care of yourself, how do you take care of your loved one? How do you sustain it? So self-care is really important. Mindfulness is really about self-care too. Next is about very practical things about needing respite, needing relief, because the burden of caregiving is really heavy going. So you need time out, not Kit Kat, but really time out to be away from it all, right? Find respite, find relief. And lastly, I would like to think that purpose and meaning That's what caregivers need. Because you imagine, they've been doing this for so long, and after a while they ask themselves, why am I doing this?
Yes.
Why do I continue? They need to find purpose. We are very thankful that we have many volunteers who came on board to help us. In fact, they are the one who train other caregivers. They train the caregivers. We have other volunteers who help us with events where we try to, for example, we may be invited to a company and have a booth, and we talk about caregiving, mental health, and so on. So our volunteers join us, and they have the chance to share their stories, talk to people, and tell them about what we do. And that's really important, because these are the people who have gone through it, and when they share about it, it's really much, much more convincing. Right? So that's what I think caregiver needs are, but there are a lot more actually. I'm just highlighting a few. But how is CAL helping caregivers? We have many programs as well, but I just want to highlight one particular program here. It's about training, the caregivers to caregivers training. So we started off in 2012 with our first training. The first program is called C2C for persons with mental health issues. This is a 12 weeks program. Our next program was in 2018. And I remember I went to visit ADA just to make sure that we don't cross into your space. And so we started the dementia program because many of our caregivers said, it is different. The 12 weeks program is not really the same. So we created a new program. It's an 8 weeks program. So we've been running it for since 2018. These two programs are actually run at the hospital, like what ADA is doing is across the whole country, the whole island. So we run it in the hospitals, we run it with corporates. So some companies out there, they avail their training spaces for us, so we are able to run the training there. We run it with communities, so RCCCs, they allow us space, they help us to promote our program. We run it with faith-based groups, churches. Last year, we managed to partner a few temples. Right? Our next target are the mosques. Right? We hope to work with faith-based group as well. And we are starting to go into Institute of Higher Learning. And that kind of led us to the third program. We started this new program with the support of Youth Corp Singapore. We co-created this program. It's an 8 weeks program for young caregivers. We launched it in May, but May is what? May is right smack in COVID-19, right? In fact, that affects all our programs because our programs are face-to-face. So we went online. We went online for all our programs in February. For dementia, we are going to relaunch it. We took some time out because we are not sure, because in our experience, dementia has a lot of interaction in the classroom, so we decided to hold off. But we are going to launch it again in October. Right? So we have 3 programs, and we have done online. In a very strange way, COVID-19 is really interesting for us. I mean, here in this picture, you see various graduation classes. We miss that, having the chance to come together, celebrate 12 weeks being together. It was wonderful. So thus far, CAL has trained in the last 8 years more than 5,000 people, 5,000 caregivers through the 3 programs. But COVID-19 changes that. But in a very strange way, it was good for us. We realized since February that many people do subscribe to our program. In fact, I've attended 19 graduation classes. Can you imagine that? Starting from June, 19 graduation classes. And many of these caregivers share with us this. They say, if not for COVID-19, I would not have attended your C2C program. You know why? It's very tough for them, rushing from home, from office, going down to the hospital or somewhere just to attend a class in the night for 2 hours plus. It's very tough. And this goes on for 12 weeks. So many of them, before it starts, they don't even want to think about it. But now with COVID-19, it's okay. They can access the training from where they are. So we are very glad that because of this, we are able to meet the needs of one particular group of people. Previously, we could not reach out to them. I'd like to share with you some of the things that our caregivers are saying to us. Benefited tremendously, learn from the experiences of others. Because in our program, we do a lot of sharing in the 12 weeks. They are encouraged to share because what they share turns out to be tips for other people. It helps others. My relationship with my husband has grown better. This is actually from somebody who went to your ADA course. It's a Malay lady. And she shared this with us because she said that something has become very positive for her and her husband. Her husband was suffering from dementia. So this is the change that she experienced. And one of them at Tan Tock Seng Hospital, he came with the wife, and they said, life has become a lot better because of Cal. And they are so appreciative because they have gotten the tools that help them. And I like what he said. He said, there is hope. And this come out again and again. There are few phrases that come out again and again. For example, we are not alone. And I can share with a group that I can trust. So, have we done enough? I like this question. All right.
Enough or not enough?
Not enough. Look at the numbers. Look at the numbers. The mental health study in Singapore 2016 by IMH says that 1 out of 7 Singaporeans will experience a mental health issue in their lifetime. Right? If you take 5.69, this is fresh, very fresh, right, from the press. Just recently it was announced 5.69 million people here in Singapore. If you take 1 out of 7, how many would that be? 812,000 people. That's a lot. And we are only assuming 1:1, right? One caregiver looking after one person. And I haven't even added the dementia statistics. Yeah? One care for one. But the truth is that it affects families, right? One person is ill mentally, it affects the whole family. One person enter into dementia, it affects the whole family.
Yeah.
In our experience, we easily see 3 or 4 persons coming to our classes. So 3:1 is the more likely number. So the task before us is huge. Because in the last 8 years, we have only trained 5,000 people. There remains 800,000. So we are really, really keen to do more for caregivers out there. So this is my last slide. And I'm glad for this opportunity. I remember meeting Daniel Lim, co-founder of Enable Asia. He was in one of our first C2C dementia class, 8 weeks class. And I'm so glad to see how over the last 1 year plus, 2 years, so much have changed and things, and the contribution he has made to Singapore through this program, this event, Enable Asia. And we hope for the same for many of our caregivers, that they will truly be empowered, just like Daniel, right? Engage them, equip them, empower more of them. We felt that there's so much to be done. We want to journey with our caregivers, but we hope this journey will turn into a movement. I mean, not just for our own organization, our caregivers, but with partners from ADA. AIC is a strong supporter of CAL. Thanks to Weng Mooi, we were able to do a lot more, and we are very grateful for that. But we want to see a movement so that our growing pool, our growing numbers, the caregivers we have, as they come together as a community, we hope that we will truly be a force for good. And so that's where we are today. Definitely a lot more to be done. So back to you.
Wow, clearly the answer to the question has already been articulated loud and clear, not enough.
Okay.
Yeah, but having said that, I think there are a lot of the programs that have been mentioned, intervention, that you have for caregivers. I'm just very concerned. I mean, at the back of my head, how are these then communicated to those that really need it? And I think that will be a very big question for everyone. I mean, for those who end up in these spaces, clearly they are aware, but the ones that actually need it are not in these spaces for various reasons. Yeah. So let's get the exciting part of this conversation. You've already done your share of sharing. And I'm looking at the screen that we have right in front of us. The audience has been working very hard to ask all these questions. How many do we still have on board right now? Any numbers that I can't see? My aging eyes. No, I'm not looking at the question. Number of participants. How many? 60? 60? Wow, 60 on a Saturday afternoon listening to us here. So thank you, all 60 of you. If you're a caregiver, thank you. If you're not a caregiver, as Tim said, you are a caregiver to be. So be prepared. Okay, there will be some questions that I will answer and some that we may have to skip. So please don't feel offended if we did not answer your questions. But I think we'll start with the first one, because we were talking about Alzheimer's disease just now. And the first question says, what are the ways we can support those with Alzheimer's disease? So this is probably a caregiver that's asking that question,
yes.
yeah?
I hope I have covered, quite sufficiently in my presentation about what is available from ADA. But ADA is not the only organization that provides support for caregivers of people with dementia or Alzheimer's disease. There are many more, including TIM as well in CAL, AIC, and a lot more other organizations. So it's just trying to find that. I mean, we have, you can definitely come to ADA. We have a website, www.alz.org.sg, but just type in Alzheimer's and you will come up in Singapore. Go to our website, it's all there, so there's a lot that you can find out.
Yep.
And AIC also has their helpline and all their websites that you can go in.
Yep.
It's all there, so just look out for it. Yeah, there's a lot of help available.
If I may jump in here, and I think that relates also to number 3.
Yes.
As part of our work as agency is to see how else beyond ADA,
Okay,
right?
I'll pause you for a while
yeah.
because they may not be able to see what is being asked as number 3.
Sure.
So let's bring it down a little so that I can see. So
Right.
the third thing that was raised in this, as
Yes.
Dr. Tan had pointed out, is one of the members in the audience has said, there are these caregiver resources is very important. We all agree with that, yeah? And
Right.
between the three of you, the resources are aplenty.
Right.
But is there a way that we can centralize the information and to make that accessible? AIC could perhaps, so that's a suggestion, and you can take that on. AIC could perhaps look into working with ADA to find a way to create a more visible platform instead of just from an agency perspective. Find the easiest way for access to these resources. And as I'm reading off the screen, I actually drew 3 circles on my little thing here. One circle is AIC, one circle ADA, one circle CAL, and then I colored the center circle like who is that center circle, can we, and I'm sure there are other circles that are
Yes.
around, right? It's not just the 3
Yeah.
of you.
Yeah.
So moving on to your response to the
That's
third.
right. Yeah, so it's actually the 1 and the 3, right? So I think each of us have a role to play. Very importantly, ADA, CAL, and many of the other community partners out there, like BRAM, like Montfort Care, Fei Yue, St. Luke, and all that, right? And that's part of the agency's role, is to work with the government to get funding, how to build up more of these services and support, and providing the professional help as well as training and all that, and also develop resources or co-develop resources together with our partners. And in fact, we have this called Partners Alliance. Some of the things that we are trying to do in terms of moving towards dementia-friendly Singapore. So ADA is one of them, KTPH, and then MOH themselves, and we actually have one caregiver who is very active, who help us to design, a more appropriate caregiver resources in accordance to their journey as well. So as agency, our job is then to see how we can be able to get funding to provide that to our partners. Because as Jason has earlier mentioned, right, the WISE studies that was done and published about 2 years ago, it was commissioned by MOH, and IMH is the lead in that. 1 in 10, Singaporean has dementia, 60 and above. So as the number is so huge, right? And I'm sure Jason can share with you, not all caregivers will come forward.
Correct.
So we need to have more out there. We need to have more agencies in terms of social service agency support, and of course, ADA is one of our very national kind of team, and likewise CAL, because their focus is mainly on dementia, and for CAL mainly on caregivers. And we work with these 2 kind of like at the national level, but across the various constituency areas as well. AIC do need to work with them, because not everybody can go to Alzheimer's disease ADA center, right? Because they might, for example, ADA don't have a center in Woodlands. Somebody who stays in Woodlands may not want to travel all the way down, yeah? And that's where we work as create a platform together with them, yeah. So whatever things that we created, we provide it to all our partners to distribute. Whatever our partners develop, we also will have it in our website. So then people that happen to chance upon our website can then say, hey, actually there's ADA I can call as well. Yeah.
But
So-
that's the thing, you see, if they chance upon.
Yes.
If they don't chance upon,
Yes.
then how?
Okay. So that's one of the challenges like yourself, right? You're saying,
Right.
I should have known that better. In fact,
Yes.
about a few weeks ago, I was in a caregiver forum that was organized by Aging Asia as well, together with SAL. And one caregiver actually said, after having to go through the journey for a couple of months, then she realized there's an AIC that can help her. So I think there's more for us to be able to do,
Right.
to reach out, to be able to get people to know. And that's where if people say, what can I do? Please go and tell the world about there's ADA, there's CAL, there's AIC, and there are many other social support services that they can go to, and they can then get help from there and get to know where else can get the resources.
I think at this point it's appropriate to say that this festival is that
Yes.
very initiative that brings everybody together, almost as if it's a consortium where we can come together. So with your support on this, more can be done through Enable Asia. Am I correct?
Yes.
I just twisted you for that.
Yeah, I also want to add that actually
Yeah.
the month of September is actually World Alzheimer's Month.
Right.
And the 21st of September is World Alzheimer's Day. But because 21st of September doesn't always, it's convenient for the whole world to commemorate
Yes.
dementia. So the Alzheimer's Disease International, which is an international body supporting dementia, decided that the whole month of September is World Alzheimer's Month. So that's why I'm very pleased that, for this festival to have happened now in
In the
September
month of
as well,
September.
to commemorate and talk about dementia. In fact, the team that is going, the worldwide team for the last 2 years or 3 years for World Alzheimer's Month has been, let's talk about dementia. So this is
Great.
exactly what we are doing here,
Yes.
which is
Yes.
perfect. Yeah?
Yes.
Just getting the message out, getting people to be aware of what is available. There are still gaps, there are still things that we need to work on, there's still how to navigate the system and things like that. But it's just, we have to start. We have to start somewhere, and we have to
Yes.
keep talking about it so that more and more people know about it.
Yeah, and this indeed is a significant start.
Yes.
Yeah. Okay. Someone mentioned young caregivers, and then in a state where a young caregiver has to come from school and to give care to a family member, for example. So there was a question from the audience there. Is there will there be any specific support? Maybe I might shift the question again. Maybe there is already specific support for young caregivers who may still be in school or who have only just joined the workforce. And with that, it's quite challenging because you've only just begun, right? And after that, something at home that you have to deal with. Is there a place that the person can go to, or to look for that support? Any of you can?
Could I take that question? So as I explained, this year in May we have launched the C2C Caregivers to Caregivers program for young caregivers, and really this is a partnership between us and Youth Corps Singapore. We are going into the schools, the IHL. We are not yet going into the secondary schools and so on, but that's where we are starting. So the model that CAL has is actually this. We start off by creating awareness. We invite some of them to commit to a program for 8 weeks. But through that program, we find people who want to do something with us as a volunteer. And we train them, and we go on to make them conduct subsequent program. So yes, it is not just about training through volunteering as a trainer, but there's more than that. We also have support group as well. If you look at it carefully, our program, every time it ends, that's the start of a support group.
Right.
Because if you have been journeying together for 8 weeks or 12 weeks, you form bonds with the people that you journey with. And that's what we are trying to create. It's really very much ground up, but I would like to have a special request here.
Sure.
We talk about how do we let people know, right? So for us, we have dedicated staff who goes to the corporate world, engage with the corporate world to ask them, do you want me to conduct a lunchtime talk on mental health, on stress, on anything, right, related to our kind of work? We do that, right? And through that, we are actually looking for caregivers, right? because, as we said,
Going outreach, right?
yeah,
You're
we are doing outreach. And so, if you are working somewhere, please reach out to us. We are more than happy to engage with you and to talk to your HR, your bosses, and see whether we can do something for you. And that has worked a lot for us. We are now into several banks, Deutsche Bank, HSBC, even Price Waterhouse, UBS. Because they are also concerned, because they are concerned for the mental well-being of their staff. They go through a lot of stress. So when we come to them and say, we can offer something for you, a lunchtime talk, they welcome that. But that's just getting our foot into the door. But really what we hope to do is to establish a community in each of these workspaces, and we grow from there.
I think it's more than that actually, Tim, because you mentioned earlier that about someone, the quote that you gave, the performance dropped. So I assume the appraisal must have been really, really unpleasant because he or she may have been, taking care of the parent and not being at work. It may affect the productivity and all that. And so my question, which you have now kind of answered, is how do we then reach out to hirers and employers in order to change that mindset, in order to be more accepting and embracing and empathetic towards caregivers themselves? And I think when you say that you're going into these spaces, you're not just providing that bit of information or knowledge, but also slowly shifting the way they should see things and to shift their mindsets a little bit without being too confrontational and say, don't mark this person with a C just because, he's gone off to take care of his dad. So I hope this continues, because the shift really needs to be with those in positions of authority and power. Okay, more questions. They showed me this one. I'm being flashed. This very interesting thing. I'm 65, says someone. Wow. And fear dementia may set in and may not. That means the person who's 65 may not have a caregiver. Wow. I'm going to wave to you, whoever you are out there. 65 and fearing dementia may set in. How can those living alone, what can they do to take care of themselves? That sense of being alone, no caregiver, no children, and then suddenly you realize, or you don't even know that these are the symptoms. Anyone at all?
Could I start first? So this is where it makes a lot of sense. You go for a class that teach you about caregiving. By the way, we have some caregivers, some people who attended our classes who are actually not caregivers.
Oh.
They are not caring for someone, but they are caring for themselves. They are suffering from a mental health issue, so they are actually caring for themselves, right? So we are not very strict on saying that we have to do a check, to make sure that you're really a caregiver before we accept you. So my staff will assess that. But if you imagine this 65-year-old person really concerned, give us a call. We are more than happy to have you come on board, because what is going to happen is this. Firstly, you'll gain the knowledge, in a way also how to self-care. Because as you become aware and your mindset change, you are more ready for that eventuality. But the biggest advantage is really you are plugged into a community. You're afraid of being alone, right? But if you are part of a community, firstly with a small group, maybe 12 of them, 15 of them, and if the bond are strong, and maybe internally there's a smaller inner group that you're comfortable with, that's your support. That's your friends. That will be your group of friends who will journey with you for as long as you take. And that's what we are trying to promote within CAL. That we teach them not just to feed on each other, but to give to each other, right? And to remind them that this is really a long journey. So we hope that many small little support groups will spring out, and they are part of a larger community, and they will have opportunity to look for other friends within different groups and within the larger CAL community. So that's what we hope to do. And in fact, one of our programs is about having a group of them come together. Those who don't have any group, we want them to come together for 1 year. So they meet every month and they learn how to interact with other people, right? And the idea is that we want them to be self-organizing. Our first class has already graduated. In fact, I hardly hear from them. I like to presume that they are self-organizing, and it's true. I did plant somebody within that group, and they are reporting that they are meeting on their own. But there's no need for them to report to us. What we are happy to see is that they are learning to be able to take care of each other within their own group. So I imagine that, yes, for many lonely people out there, please don't stay in that way. Just get out there, meet friends, get to know people, learn something, and really be a friend to other people first, right? And then you will find for yourself then people who will journey with you for the longest time. Right? And they could be younger than you, and they could care for you too at some point in time. Yeah. So that's how I see it.
The fear is real. I mean,
Yeah.
from just reading that line from a 65-year-old audience member, even as a caregiver, the fear is so real. As I mentioned to you when I first started seriously looking after my parents who live with me, I remember a time, when I went to meet a friend who is quite a seasoned caregiver herself. Her parents are quite very much advanced in that. And when I met her, I had no words. I told her, I really need to meet you because I'm having some issues with this whole caregiving thing and I don't know what to do. And she says, sure, we'll meet. And the minute I sat down and all I could do was just stare into blank space and then and I think it helps when you meet someone who has experienced it, Not so. It's very different when you see a therapist, but someone who's experienced and journeyed through that to be sharing it with you, and then you say, "Hey, actually, yeah, I know that. Yes, that happened." So that was great. I have a cue for that, but I want to ask this one question first, and I think if you help me scroll that up and down, whoever's behind that screen. There was a question about funding, and this is a very thorny question. Thank you, we have 10 more minutes. A very thorny question, but I think, we've all warmed up, and I think it's a thorny question for even people who are working and then loss of income. When you have these programs on board, and I'm going to rephrase that because they said, government needs to allocate more sources. Should or not? My answer is yes, of course they should, right? But my question is, when these programs surface on the screen for us, what does funding look like? Is it readily available? Is it free? And that's what puts people off when they say, "Alamak, so many things." But then how much? Then click, cannot. You know what I mean? I'm sure it's more compassionate than that. I'm very sure, and I thought I'd ask you and hear it from you yourself. What are the ways and means of doing this? Is there a means testing? Do we have to submit 250 documents before we clear that? Do you know what I mean? So maybe you can just give us a teaser of whether these programs are financially accessible or not. Tough one there, huh?
Yeah, I guess it's a balance, right? I always tell people, where does the government get money from? It's from us.
Correct.
Taxpayers.
Taxpayers.
Right? Yeah. So I think government has the responsibility to ensure there is a balance.
Yes.
And everywhere, money is never enough, right?
Yes.
Yeah. So for services like center-based care, nursing home, there are means tested, right? And so then it depends on their income and things like that. I mean, we do know there are so-called some people who kind of not pass the means testing.
Correct.
So it could be a bit challenging.
And then the sandwiched
right.
generation.
Yeah, so there, of course there's other funding, right? So, and then the other part is also government also realize with aging, with a lot more so-called disability, whether it's physical or mental, and that's where the CareShield Life came along, the lifelong insurance, and that is very important as one of the way to ensure that no Singaporeans or residents of Singapore don't get services. I must say I was Malaysian and I have brothers who work in England and overseas, and I studied in the States before. I say our healthcare systems are fairly good.
Okay.
Yeah, of course there will be gaps that we should continuously improve.
Yes.
Now in the area of dementia and mental health, so we were a bit more, I would say, lucky because we started our journey in 2011. So most of our programs are heavily subsidized by
So they're heavily
government.
subsidized,
Right.
which means no one's going to be
Turn
around and go back.
So in fact, like some of the program that I work with team, right, the training program, as
Tell
well.
them it's free.
Yeah, even
You sure not?
Yeah,
Must
yeah.
tell
My
the truth.
programs are
Your
all
programs
free.
are
even
Yeah.
even home intervention program that like Jason mentioned, at this juncture,
At this juncture.
yeah, it is still free.
Okay.
Of course, there are some charges for some, right? But like for example, I know a social service agency like ADA, they actually sometimes fund the family members if they can't afford.
So
like
there are
elder
ways
citizen.
to-
Yes,
Even
yeah.
if it is something that they have to pay for, there are ways
That's
to
right.
get around
so,
it.
So I think, I mean, of course, we're not saying it's perfect. There's always room for
Yes.
improvement. So if people can come forward and share with us and let us know, then there are ways and means that we can help. Yeah.
I think I would like to add that I think the AIC Ministry of Health has been very supportive actually financially about programs that charities run and all that. But as what Weng Mooi said, money is never enough. So there are times that, like also what Weng Mooi said, sometimes even with the subsidies and all that, caregivers still struggle, right? So then that's where the associations like Tim and myself, we have to fundraise basically to help plug that little gap or the shortfall, just to make sure that nobody loses out.
No one gets turned away
because they can't afford.
Because that's the first thing I think for any one of us. Whether they are able to afford it or not. It does affect the balance of how the finances are at home. So that's a very assuring thing that I've heard.
Yeah, but to the community, Tim and I, we ask, please help us. We need help, especially during this COVID-19.
Yes.
It's very tough. So please try to continue to help us.
Yes. And then that would go out to, entrepreneurs that can support, generous people all around. Please help them so that they can continue to also help the community of caregivers that need help. Okay. I'm mindful of time. We're signaling, and then now we're all warmed up, right? So can you move down the slide to number 5? I can, as I speak. Yeah, and this is a very happening question. Okay, but I'm gonna rephrase it a bit. So we had all these programs, so happening your programs. Then Tim said, please, it's free. Okay, so it's very happening. So enough, not enough, but got program or not, got support, not got support group, all sorts of things, right? If I were to ask you each to let me know what is missing, it's like your wish list, based on the spaces that you run, based on your own experiences and journey, and it could even be, as from the ground as possible and as honest as possible. What would it be, and how can the public be involved to effect improvement? I will start first because I'm from the ground. I really want access to this, and I'm sorry, I have 5 kids and 2 aging parents. I want easy access. I don't want to call and then you all say, oh, go call Tim. I call Tim, Tim say call Jason. I call Jason say call Dr. Tan. I call Dr. Tan asked me to call Dr. Lim. So I also don't know, and then I get very frustrated. I say, forget it lah. I go call my friend Danny because he has a mother also who's not feeling okay. My mother also not feeling okay, and then we talk and we'll never get your programs lifted. Then it's not a win-win for everybody, correct? So for me, I want access, and how can the public be involved? I want this is my wish list, and after your turn, I want these initiatives to come out in a way that is sexy, and I'm not talking about sexy, that it's attractive, that we can is it influencers that are talking about caregiving? Is there a hashtag that goes viral? Is there an ambassador for caregiving? That's my wish list. Over to you.
I think for me, the one thing that I wanted to say is, or the last thing that I want, or wish list is, I think getting the community to step up. I think Tim did mention about it. I think for us, all the charities put together, AIC, MOH, we all try to do as much as we can. But really, I think the community can still step up and support.
When you say community, who are you referring to?
We're referring to people, the public, the general public,
Okay.
Neighborhoods, because there are a lot of people who can still help. They are well elderly that can help those that need help. And I think if everybody steps up to help, then it will create a society or community, as also Weng Mooi mentioned, what we call a dementia-friendly community,
Yes.
where people with dementia are supported, they're not fearful of going out, they're not fearful of getting lost. Caregivers know that support is available not only from ADA or CAL, but many organizations that are around the neighborhood. So, in that way, for a person like this, back to the question of a 65-year-old, in that case, then you are not fearful of getting dementia, because
Yes.
if I get it, life can carry on.
Yes.
It's not the end of the world for me.
Yes.
So I think that is our hope.
Fantastic.
Yeah.
So community step up. That's the wish list. Community, you step up. Okay, Tim.
I just have one wish.
Okay.
I would like to scale, because as I said just now, the numbers 5,000, 8 years is really miserable.
Yes.
And when you think about the needs out there, it's really, really miserable. So we want to scale, we want to grow and reach out to even more people out there. In fact, one of the phrases that was mentioned in the slide was this: I wish I could have known about Cal much, much earlier. Because for him, he has been struggling for many years until one day he discovered that Cal was there. In fact, he used this story. He said, he shared this, it's very interesting. He said, it's as if I am on an island. Every day I'm staring out into the ocean. No hope, nothing to see, he's stranded. But lo and behold, one day he turned back and he went the other direction. And he discovered on the other side of the island was Club Med. You get what I mean?
Yes.
So Cal is Club Med to him. He said, I never realized that Cal was there, and So I think there are many, many caregivers there who didn't know that there is a free program for you, and it's a powerful program, and you're going to be plugged into a community. So please come and join us. So that's
my
just expand. Okay. We can do more, and we'd like as much help as possible, funding, more caregiver volunteers, and so on. But the fundamental idea is that we have not done enough. We need to go, we need to do more, we need to expand, we need to get more people to come to the program to be helped. So that's my wish list. Yeah.
Nice, thank you. It kind of ties in with my wish list because I want to come, but then I don't know.
You're invited to our program.
So yeah. Okay, Dr. Tan.
So if I might say, I echo all of you, and I like to...
You don't play cheat, can I? You almost have your own wish list.
So I use what Tim say. I think we should start a movement.
Yes.
And I think a lot of times is people feel shy, caregivers you feel bad. They shouldn't do that.
Guilt and fear.
So in fact, sometimes when we do sharing, we always end with one slide, I call, to build an inclusive society. I know, I want, and I can. I know means I know about the issues. I know about the illness, right? So early on, I think Tim and we all talk about the training. Because training is all about knowledge, skills, and your own mindset. And I want, right? And I want, whether as a professional or as a caregiver, I want people to know and to include whatever things that I have that I need to know into their daily practices, whether you're employers, you're healthcare professionals, or you're my friends, right? And I can as an individual, as one of the community, as one of Singapore residents, can make a movement and get everybody to come forward. So to me really is, as Tim said, let's start a movement. Let's get a caregiver and the public, because you're going to be a caregiver to be, right? In fact, I used to ask people when I give a talk, how many of caregivers? A lot of people, actually they have older parents, but they say they're not caregivers. Why? Oh, because they stay with my brother. And caregivers also, when you're looking after kids, you're also a caregiver, but we call you parents, that's all. So if we could start a movement, right, that I know and I want and I can. And I think that way, then we can get everybody to understand. And then you can then have voices. To ask for more from government or for philanthropists who are more than happy to help us. So that's my wish list.
I know, I want, I can. So who's starting this movement now? you put.
No, that's where Daniel and the team, right? Enabling Festival.
We are talking to you right now. But yes, that's I think that's a wonderful way to end our session. How are we with timing? Very good. We want to thank the audience first for being very engaging and engaged with us. For those of you who stayed through almost 1.5 hours with us, I'm quite sure you are here for for a reason. And I hope that you have found the answers to your questions. But having said that, I hope you continue to have more questions, because that's when change happens. And please join me now to also thank my friends in this little studio of ours. Tim, clap, 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 clap. I miss having a live audience, Jason, and also Dr. Tan.
Thank you.
Thank you for joining us once again for the first Zoom In of the Enabling Festival. The festival is going to continue it started yesterday, right? That's right. And it will go on till the 16th of October. So for more information, please go to the website, and it's the Enabling Festival website. Until then, till we meet again, stay safe, keep your distance, wear your masks, and take care. Bye-bye.
Bye.
Hi, I'm Daniel,
I'm Danny.
and we are the co-founders of the Enabling Festival 2020.
Yeah, the Enabling Festival is in its third year now, and it certainly has been a long but rewarding journey.
At this note, we hope you can support us by pledging $1 or more to the Enabling Festival 2020. We've got this link right down below here.
Yeah, this pledge will enable the festival to further the cause and implement more initiatives for a collective impact which has societal benefits for the dementia community and caregivers.
Dementia is a very real issue that could happen to you and me. We sincerely appeal to you to walk this journey with us.
So come and participate in the various programs that we have lined up for you, and we hope to see you online at the Enabling Festival 2020. Thank you.
Thank you for watching our program. We hope you can help us to fill in a simple survey using the QR code provided at the end of the program. Now, this will help us to improve as well as to fulfill our funding requirements from our various funders. Please help. Now, if you have any questions or if you wish to find out more about the Enabling Festival 2020, please visit our Facebook page, Instagram, and website to see what we have lined up for you. Drop us a message on any of the social media platforms. You can also write to enablingfestival@gmail.com, and our colleagues will reply to you as soon as they can. Take care and stay safe.
When we cannot see, doesn't mean